We spend more money every year on health. We just do. We put more money in every year. The government claims it's spending an extra $16.6 billion on the health system. And it is. But it's not spending an extra $16 billion next year. It's spending an extra $16 billion over the period to 2030. So every year, we spend a little bit of that $16.6 billion more money because we forecast out spending over 4 years. So in reality, we're spending about $1.3, $1.4 billion more every year. Now, great. Only the question is not, are we spending more money? That's true every year. If we spend an extra dollar, we're spending a record amount of money. The key thing is, are we spending the right amount of money?
Hello and welcome to another episode of the Frontline with Gary Payinda. We're going to have an exciting conversation today about budgets. Don't hang up yet. I'm sure you'll be interested in what we have to talk about. I've got a guest on this week that is the Council for Trade Unions, the CTU, like Union of Unions, chief economist, Craig Renney. And you may know him and love him from his podcast on BHN, Locked Out, from his briefings about the budget periodically. And hopefully today we're going to talk a little bit about the healthcare budget, and he'll give us some updates on what's been happening in terms of money and where the health budget is going, and maybe a little bit about where the economy in general is going. So without further ado, let's pop you over to Craig Renney. Hello, Craig. How are you doing?
G'day, how are you?
I'm well. It's good to see you. I think one of the last memorable times I had with you was asking you to explain the situation with the budget, where the other side kept saying it's getting bigger and it's better and we have more money than ever. And I asked you to please put it in simple terms, and I'd like you to do that again for me. My memory isn't what it used to be. So, Craig, you're the CTU chief economist. Can you explain to me these two disparate ideas? On the one side, you have Simeon Brown, health minister and National Party and all of that, saying this is the biggest health budget ever. It's the most money we've ever put into health. And we're doing a great job of backing health in New Zealand. Better than anyone's done up until now. And on the other, I occasionally see things saying that actually our health budget has shrunk and that it's less than it used to be and that we've gone negative. So can you explain that to me, please?
Sure. So both things can be right at the same time. So we spend more money every year on health. We just do. We put more money in every year. The government claims it's spending an extra $16.6 billion on the health system. And it is. But it's not spending an extra $16 billion next year. It's spending an extra $16 billion over the period to 2030. So every year, we spend a little bit of that $16.6 billion more money because we forecast out spending over 4 years. So in reality, we're spending about $1.3, $1.4 billion more every year. Now, great. Only the question is not, are we spending more money? That's true every year. If we spend an extra dollar, we're spending a record amount of money. The key thing is, are we spending the right amount of money? Are we spending enough to keep up with the cost of living, with demand, with all the things that we want out of a health service? And right now, the answer to those things is we are absolutely not spending anywhere near enough money to keep up with inflation or to keep up with other pressures. So the $1.4 billion, when we look at what that means in terms of additional population, when we look at what that means in terms of costs, at the first budget, the amount of money that we were spending below inflation, that actually fell by about $190 per person in real terms. So the purchasing power of the money that we were spending, it really fell. When we then go to the next year, to the last budget, it fell by $50 per person in real terms. So every year we're spending, but we're not spending enough to keep up with the cost of living or population pressures or what we call in the trade demographic pressures. We have more elderly people. We have more people with more needs. We're very good at keeping people alive for a bit longer, which is great, but costs more money. As a consequence, we're not putting enough into the health system to keep up with demand, population, or with the cost of living pressures. So yes, we're putting more money in, but we're not putting anywhere near enough in order to be able to meet true demand in the community.
So I really want to understand this, and I guess I don't understand how a government that potentially might be around 3 years will claim as a win, as a record investment, money that will only be spent theoretically 6 or 7 years off in the future. They may not even be around at that point. That would be like me saying in 2031, my income will be twice as high as it is now. How can I possibly say that with any legitimacy? So, is that normal for people to talk about how much money they will have put in when they might not even be in government anymore?
It's possible to talk about it. Whether or not it's legitimate or sensible to talk about it is a different matter. In reality, where the number that exists, the $16.7 billion number, that exists because they've extrapolated out a number of years. In between there and then, we're actually likely to spend more money than that anyway. And we're likely to actually need additional services along the way. So it's actually a nonsense number. It doesn't mean anything. It's not a figure that's helpful for the public to help them understand how much real money is going into the health service.
I think for a regular person, the way anyone would figure out their budget for next year, like if you could put that in terms, please, that we would understand. Is the budget more or less for health? Let's say next year, this year, next year, is it increasing?
So it goes up next year. It goes up by a predetermined amount, which is about $1.3 billion. The question is that enough to meet inflation and other challenges? Because that's the amount of money, that's all of the money that exists to meet cost pressures. And it's not. It's nowhere near enough. And the government knows that. The government was told in the May 2024 Select Committee that it would not be enough to meet cost pressures and other demands. I mean, the important thing as well is that the government places new demands on the health service. It says, oh, we're going to have a new fund to tackle cancer drugs, or we're going to have a new program to tackle some kind of health need, right? But it doesn't put any money alongside it. That money has to come out of that same pot of cash. So when the government asks the health service to do something new, but doesn't put any new money in, that acts just like a cut in the rest of the health service. And the best example I can give you of this is the government set aside $285 million for new GP programs and new GP practices to help encourage new GPs to open up, which is great. We should do that. But that money comes out of that same pot of cash. So that's just the same as
how do you make an announcement of spending money when it's essentially coming out of the same pot of money that you had all along?
Because you say in the bottom, you say, this project is made available because of the record investment in health that this government has delivered. You don't say where the money is coming from. And as a consequence, you get to spend the money twice.
Okay. You know the $2.9 billion that goes to the landlords, or the 200 or 300 million that's set aside to help Philip Morris Tobacco Company sell more heated tobacco products. You know, these like millions and hundreds of millions and billions of dollars. Are they getting rid of those because we need the money elsewhere? Like, have those policies been reversed, or are they still currently handing out that money, even while we're saying that we need more money for health or welfare, housing, or roads or whatever?
Oh, they're very much handing out the money, and it's real cash. This isn't make believe cash. This is real money that's going out to people. The landlord tax cuts and the $2.9 billion, that pays for approximately, if you were to use it, about 37.5 million GP consultations. You could either have landlord tax cuts or 37.5 million GP consultations. To put that into context, that's about 3 years completely free GP visits for everyone.
Wow. Wow. So when
So yes,
government says we're broke, there's just no money for health or firefighters or nurses or whatever, teachers. Um, they could end these programs, right? They could go to the Philip Morris Tobacco Company and said, "I'm sorry, we don't have enough money to give you 200 or 300 million. We need to end that program of corporate welfare." They could do that, right?
Oh, absolutely. We have a tax bill permanently in the House. Every 6 weeks, we produce a new tax bill in the House because there are always loopholes and exemptions and things that need closing and we need managing. So there's always a tax bill in the House. So we can do that. We could attach it to the latest tax bill that's in the House and say, done.
Wow.
Um,
Anything else new in the world of budgets and finance that we should know
Oh,
about?
absolutely. So we're going to have a half-year economic and fiscal update next month, which will be the next chance to see the books. The economy is now about 1.3% smaller than it was at the election. So despite
Mm.
all of the talk, the economy is now gone backwards since this government was elected. And we're collecting, we expect, a significant amount less tax, which means the government's books will be under even more constraint, which means it's very likely that the half-year update will signal even further cuts to government services and to government spending. But for those of you who are following along desperately at home, there's a small note in a slightly obscure document called the Financial Statements of Government at 2025, 24-25, which is the audited accounts of the government. And if you could bring that screen up, Gary, then I can show you what that looks like, which is that one there.
Yep.
That's the financial statements of government for the year ended 30 June 2025. I'm sure you've all got copies at home. If you're not, it's freely available from the Treasury online. Now, I want to point you to a footnote in page 27 of that, which is this. In addition, personnel expenses incurred by Health New Zealand were $0.5 billion lower than forecast. Now, what does that mean when we strip the Treasury jargon away? That means we spent $500 million, $500 million less than we were expecting on doctors, nurses, healthcare workers, other health professionals, lab techs, everybody else who works inside Health New Zealand. Now, this is not the ministry staff. The ministry staff aren't in Health New Zealand. These are medical staff. These are people in hospitals, other medical establishments, GP practices, everywhere else in the country. And we spent $500 million less than we were expecting in the last year. And this isn't a forecast error. These numbers inside this document have been signed off by the Auditor General. So these are the audited, finalized accounts of the government. And in it, despite all the claims that we were spending more money, despite all the claims that we were supporting doctors and nurses and other medical professionals as never before, we actually spent $500 million less than we were expecting in the last financial year.
So wait a second. 500 million was in there's a pot of 500 million somewhere that could have been spent on, let's say, fixing nurse understaffing, and it wasn't, is that volitional? Is that because they chose not to, or they didn't have the power to spend it, or didn't have the staff to hire? Like
Look,
what is behind this? You're saying they didn't spend 500 million on staff during a time that we desperately need money spent on staff, specifically, in my opinion, with nurse understaffing. Like, we have nurses who want to work and can. Could they have been hired with this money?
yes, is the short answer. We don't know exactly how it will have occurred. We have to wait for the final accounts from Health New Zealand, which will be produced in early December. But right now, what we know is that that money exists. That money was set aside to help pay for the salaries and wages of doctors, nurses, and everybody else, and that money was not expensed. That money was simply used. And the worst part is they haven't said, okay, we've underspent by $500 million. What we'll do is we'll put that into a pot and we'll save that for the rest of the health service. No, they've gone, thank you, that now belongs to us. And what it's
Where did
done,
that money go?
no, it's just gone back to the centre. And as a consequence, it's made the government's accounts look marginally better, but at the expense of not paying nurses, GPs, surgeons, senior medical officers, lab techs, everybody else inside the system. It's just simply gone to make the government's books look slightly better.
And so a proportion of that 500 million would have gone that could have been spent on, let's say, hiring nurses, would have potentially gone to giving it away to tobacco companies, or to reducing the excise tax on tobacco sales, or landlords. So some of this money would have fed back to landlords.
It certainly helped. So it certainly helped to pay for those programs. It certainly helped to pay for the $12 billion the government is committed to defense projects, for example. It certainly helped the $150 million that it's going to spend on charter schools.
Is there
On
no ring fencing of health money, or of? It seems to me that the last people I would ever want to have control over health or education spending are politicians. I would want them to set the money out there, but then let the actual experts decide where it'll go, and not be used as a revolving door piggy bank, an endless piggy bank that where the money can be stolen for other things. Is there any ring fencing of our money for healthcare in New Zealand, or can it all be pilfered by the
So
politician of the day?
again, both answers can be true. So we set aside the money for vote health, right? So we say this much money for vote health, and it can only be spent on vote health stuff. But if it's then not spent by vote health, it then comes back to the centre. And if it comes back to the centre can then use it to then manage its other expenses. And as a
Why would it
consequence,
ever not be spent by vote health? Like, we have walls that are, rotting, roofs that are caving in, leaks, understaffing, a lack of MRIs, can't get CTs to where they really need to be. How can there ever be unspent money in vote health when there's such a huge need for that money to be spent in vote health?
it's a great question. And we don't have good answers to this at this point in time. All we have is a note that says, I'm terribly sorry, we underspent on personnel in health. And as a consequence, we now have $500 million spare, warming gently in a room. And as a consequence, the Crown goes, well, thank you very much. That now belongs to me. And that now makes my overdraft look slightly better, which is the deficit. And as a consequence, I now look marginally more competent in terms of the accounts.
This is insane stuff, Greg. I'm going to show you a story that came out like 2 days ago. Rats, leaks, and overcrowding show the need for fungi hospital redevelopment. And by all means, I don't want to keep highlighting Fungidae, but it is in my Northland region. but I think every region is going through similar things. Certainly Nelson, Hawke's Bay, Dunedin, and a dozen other places. And they talk about just the sad state of affairs. I won't go into the details of rats or leaky things or whatever, but I will say things that they highlighted here, like rooms that are not meant for patient care being used for patient care, right? They describe this as a cupboard. I don't know if it's a cupboard, but what they're describing here is a very small room, too small enough for like monitoring or IVs or all that sort of thing. And when there's the hospital's overwhelmed, they're sticking people in these places because they want to try to care for them and they want to try to do what they can. And so the New Zealand Nurses Organization is highlighting some of this stuff, talking about how, the population grew by 24%, but the ED hasn't grown since 2011, that sort of thing. We know we need the buildings. Even the managers are quoted here saying, we understand the need and it's real. Talking about how in 2031, a 158 bed ward tower has been announced and they say will open, but it also says it's not yet funded.
Mhm.
I I don't really, and then the last bit is about nurse understaffing. I just don't understand how there could possibly be $500 million sitting anywhere in a government budget for healthcare that then that isn't spent and then goes back into the general pool of money to be spent somewhere else when there's such need. I don't get it.
So essentially, you're not wrong. I mean, it was the same problem here in Wellington, right? We have a hospital that recently was going to close its maternity wards to expand its accident and emergency wards because they had to make a choice between delivering babies or having an effective ED department. We have a children's hospital attached to the Wellington Regional Hospital that was paid for because a very wealthy man wrote a check for $50 million. This is not how we run a health service.
Right.
And as a consequence, the health system is desperately short of money. The Crown had set aside this amount of cash. It had forecast it was going to spend this money. It's underspent that amount of money. And rather than then, dealing with that problem, rather than saying, oh, okay, hang on a second, what's going on here? It's just said, well, this is fantastic news. Thank you very much. Now,
Wow.
on the slides there, Gary, I've got some examples of what that could actually buy. So what could $500 million buy? So it's just shy of 5,000 new nurses. It's about 6.25 million GP visits. It's about 6 months supply for everyone across the country, free. Everybody could have 6 months off paying for any GP visit. It's about 2,000, could be up to 2,500, depends where you stop counting, senior medical officers. Or it's 4 years, 2 months of absolutely free prescriptions for everyone. Those are the choices that we're making at, when we say we're not going to use that money. Now, to me, the big thing is $500 million would provide a very large part of managing the current pay challenges for senior medical doctors or for nurses or for other health medical professionals who currently are being offered below inflation pay rises, which is a big reason why so many of those medical professionals are not unreasonably then fleeing the country and heading to Australia or to somewhere else.
Um, does anyone know about this yet, Craig, or is this some little weird thing you found while trawling through the budget? I mean, is
Well,
this reported by the media?
I'm not sure it has been reported by the media, but certainly the Treasury knows about it because it's inside the books. Certainly
So
the
it's
government knows
official.
about it. Yeah, these aren't my numbers; these are the Treasury's numbers. And importantly, they're not forecasts. These are real numbers signed off by the Auditor General. So this isn't a forecasting error. This is something that the Auditor General has signed off. The Treasury certainly knows about it. Ministers certainly know about it because Nicola Willis's signature is inside the front of that book saying everything in here is true. So, yeah,
So at the same time, they were telling our nurses that there's not enough money to give to you and that you have to accept a real terms pay cut because there's just no money. There was $500 million that was unspent in the health budget that could have gone to satisfying the nurse understaffing and an underpay issue. Do
it's
I
worse than
understand
that.
that correctly?
Yeah, it's worse than that, Gary, right? There was $500 million, $500 million that was set aside specifically to pay the salaries of medical workers and others inside Health New Zealand, right? So it wasn't as if you were stealing this from the radiology budget. You weren't stealing this from the estates budget. There was money that was set aside for personnel that the government did not spend, that it's now gone. Thank you very much. This belongs to me. And rather than using that to help settle those claims, rather than using that to help manage the future cost of those claims, it's simply gone, as you've said, do you know what? We're all doing it tough, and these workers need to take a real terms pay cut at the same time as MPs are seeing a 10% pay increase.
I don't know what to say, Craig. This is
Well,
ridiculous.
welcome to my life, Gary. Economics is called the dismal science for a reason. We can, professionally depress an audience from 250 paces, but in terms of this, there is pretty much nothing that that you can say that is pretty defendable about a government that has consistently said it's spending record amounts on the health service, and it is, but that's not the same thing as actually spending the right amount of money on the health service, which would be considerably more. About a government that has chosen to pass through the costs of its tax program onto not just their doctors and nurses, but also to teachers, to firefighters, to a range of other groups who are being asked to accept below inflation pay rises, to minimum wage workers who see the value of their minimum wage go up by less than inflation for 2 years in a row, to the point that a full-time minimum wage worker is $1,300 worse off than they were at the election, to a government that is consistently telling you there is no money, at the same time as having given away more than $20 billion in tax cuts over 2 years. And now, a government that appears to have salted away $500 million from the personnel budget of the health service, at the same time as telling everyone there is no money in health, and that the best thing we can do is to look to bring in private sector partners and to sign 10-year deals with the private sector to help deliver our health services. Now, these are not the actions of a good faith actor working to deliver a good health service in New Zealand.
Wow, this is ridiculous, man. This is absolutely insane. During all of this, they've been saying there's no money, that we don't have enough to hire nurses, and the nurses have been made to feel less than. It's the doctors and nurses who are asking for too much. It's them who are striking. It's them who are hurting patients. They literally said that we're the ones hurting patients, while they had the potential to solve all of these things and actually had the money budgeted and available to solve these things.
Well, certainly they had $500 million set aside that could have been used to help manage those problems. Certainly they had the capacity to spend more if they'd wished to, and certainly they had the capacity at the same time to provide very large tax cuts for businesses through the investment boost program, through giving away $500 million to Google, Meta, Facebook, other groups in the digital services tax, which wasn't delivered, and so therefore cost the crown $500 million. They've given away money to a range of other groups. We've spent $200 million on oil and gas exploration, which is going nowhere. Long and short of it, there's no shortage of money when you want to spend cash, but in the essential services that New Zealanders want, they're being asked to do it tough, and the money that is there is actually being underspent. And then rather than using that underspend It's simply returned that back to the centre to make it appear slightly more fiscally responsible than it would otherwise be.
This is the intentional undermining of an essential public service at the same time that you're guaranteeing the private actors, the private sector, that they can keep cashing in, and in fact giving them 10-year contracts too. This is wow.
Yep.
This
So,
is just
yeah,
insane.
as you'll know,
Incredible.
Gary, big fan of numbers, right? So, one final number from me to you, right? We have about 340 days until the next election, right? We know from the voters, we know from the polling that health is the second most important issue after the cost of living to New Zealanders, right? We need to be taking every single one of those 340 days and telling the public that this government cannot be trusted on health. It cannot be trusted with the numbers. It cannot be trusted to deliver the services that we need, because the evidence in front of us is showing that even when it had the opportunity to do the right thing, it didn't. It chose to do the wrong thing. It chose to take that money and rather than use it to tackle a health problem, rather than use it to transform someone's life, it chose to make the accounts marginally better.
It's the privatization government, the corporate benefits government, the private pockets government. Yeah, I don't have much more to say. Yeah, wow. I mean, thanks for talking about this. I've often said this is the most depressing podcast in New Zealand, and maybe even wider than that, because like week on week, month on month, it's just one outrageous story after another. If all you care about is regular people getting health care, regular people getting their kids into public education or childcare or having a roof over their heads, if that's really all you care about, this is the most depressing podcast in New Zealand on YouTube. So thank you for contributing to that unbroken streak of incredibly depressing stories.
You know me, Gary. I don't like disagreeing with you, but I'm going to disagree with you on this, right? It's not depressing. It's not because it's not inevitable. We can choose different outcomes. We can choose different things. And if we choose those different things, we'll get different consequences. We'll get different outcomes. We'll get better health services, right? But we have to make a choice. This government is making a choice, and we're getting the outcomes we get as a consequence. If we choose a government that delivers different choices, we won't be on this podcast telling you all about the negative things that are here. We'll be on this podcast telling you about the great outcomes that are being delivered from different choices. So it's not depressing. To me, actually, this is just simply a call to people to help them understand we can make different choices, and if we do, we'll get better outcomes.
I want to show what those choices are. This is stark. This is 500 million, and it's easy to get confused of what millions and billions and all of these numbers are, but it's thousands of nurses. We need thousands of nurses, probably a number between 3,000 and 5,000. It's tons of GP visits. It's 2,000 specialist doctors. So I'm an emergency medicine doctor. So that would be 2,000 oncologists managing cancer, or endoscopists, gastroenterologists diagnosing and preventing colon cancers, or what have you, pediatricians. 2,000 of them would probably cover the entire gap for the country. I know that we're missing about 1 in 6 specialists within the system, but the numbers I've seen have been around that 2,000 mark. So that 500 million could have corrected that, or literally years worth of free prescriptions. And we know that when people can get free prescriptions, they end up getting their minor infections and heart problems and lung problems treated and managed early, and it prevents them from getting worse, becoming septic, showing up in an ED, getting admitted, and dying. And we have literature both internationally and from New Zealand specifically showing how much of an incredibly wise investment that the free prescriptions were, the very ones that this government got rid of. So yeah, I'm just going to close this window here. This is just it's very stark what's going on, and it's obvious to me that we all have a lot of work to do to ensure that stuff like this never happens again, because it's degrading to New Zealand, and it's degrading to the country that we all thought we had built. It's certainly degrading to the country that I came to 18 years ago, that didn't have these kinds of shenanigans. And look, I don't mind a government telling me there's no money, right? I worked in a public hospital system in Northland, poorest region of New Zealand, for 18 years now. I don't mind a government honestly saying that there's no money, but it's quite a different thing to be saying that there's no money when there really is. To be saying that there's no money to hire nurses when there's 500 million in a personnel budget in somewhere in Health New Zealand already budgeted and yet unspent. So I thank you for coming on the show today and telling us about it. I assume we're going to hear more about this. Like, what is the next step? Does someone investigate, and does Nicola Willis come out and address it? Do we get the money back, the 500 million, with which to hire personnel, or is it long gone?
These are all great questions, Gary. One of certainly we'll be pressing ministers about this at the CTU. We'll be working with the affiliated unions in that space, the nurses organization, the ASMS, MIRAS, a range of other healthcare, PSA, ETU, healthcare unions. But fundamentally, the structural answer to this question, the one that actually we all want, is how do we stop this from happening again? How do we stop the health services from being underfunded in the future? And unfortunately, that's going to take a change in government.
Thank you, Craig Renney, CTU Economist. I appreciate it. And we'll have you back for the next incredibly depressing thing you find in the budget. So keep looking, keep hunting. One day you will come on here and tell us something wonderful is happening in terms of essential services, and all of the viewers of the Frontline will cheer you on. Know that your work is supported and appreciated, and everything you've done for us is appreciated. So thank you for what you do, Craig.
Thank you for having me on.
Anytime. See you next time. Ka kite. So that's the end of another wonderful episode of The Frontline. Please share it with your friends. This message needs to get out there. Everyone needs to know about it. If there really is $500 million that didn't get spent within Health New Zealand when the need is so desperate, then we really have to ask, like, what the hell is going on? So hopefully you'll get out there and do just that. Write to your politicians and ask them to explain, please. And we'll catch you next time on The Frontline.